Hi, all. End of January. It's Doc Talk, and it's fun to be able to talk about weather events this time of the year because it's a new set of challenges at a really busy time in the fire, EMS, and law enforcement services. The key this week is an ongoing set of storms that are moving through, dumping lots of precipitation and dropping temperatures all the way down here to Florida. Believe it or not, in our forecast here in Naples, Florida for tomorrow, the word flurries is used in Naples, Florida. There haven't been flurries in this part of the country since 1989. So cold, cold safety is about layered approaches, smart clothing that you wear, being prepared. If you are caught in a situation where you're going to be outside for a while, which may mean for our public safety forces that they get an incident that they have to be prepared for. For the public, it's about being on the road. And boy, anything you can do to stay off the roads at this time of the year is really, really important. So layered approaches, changing those layers if they get wet, because the best conductor of heat away from you is water. If your mom didn't tell you that, and that the place that the most heat gets released from is obviously your head. So keeping your head covered, not letting anything get wet. If it does get wet, changing clothes. So you have to go to a warm environment, shed whatever wet clothes you have, put on the layers again that begin with the dry layer up against your body. So that cold, for those of you who aren't used to shoveling snow, and particularly ice and snow mix, which is heavier, that is a tremendous cardiovascular burden. And you should be careful, and you should stage that in short intervals. A combination of doing heavy effort and breathing cold air is particularly hard on your cardiovascular system. You think working in the heat is hard on you. From your body's perspective, if it is trying to process cold air, trying to keep you warm, and processing whatever activity you're doing, like shoveling, those are three things that your heart and vascular system really have to react to. So, surprisingly, cold weather exertion can steal more calories and put more stress on your system than warm weather activity. And your body, frankly, is set up to do activity in warm weather. That's kind of our physiology as human beings. And in the warm weather, your body gives you really clear signals about when it's had enough. You begin to get weak. You begin to get a little bit lightheaded. You get tremendous thirst. All that can be hidden in the cold environment. So be aware of that. Obviously, anything that you put on your feet and get on slippery surfaces can mean the difference between you doing whatever it is that you wanted to do and you being on the ground waiting for a medic unit to get there to take you to the hospital. It is really important in these slippery environments, and in particular for the public safety forces. Melting occurs as the sun is out, and then it refreezes when typically dark conditions get there again, and it's dark and you can't see the ice that is formed, commonly called black ice, and that is the most dangerous time. So working right after dark, working in the nighttime hours, taking on a nighttime incident, etc. Be careful and wear appropriate footwear that will keep you on your feet. If you're on slippery conditions, use those ice skating techniques to move so that there's always a foot in contact with the ice and that you're not doing a big lift, which can result as you lift and before your heel strikes, you're trying to balance on one leg and you just keep doing that. And that's much more slippery a condition than you keeping your feet on the surface like an ice skater would. So those are really simple techniques to keep us safe during yet another week of these really icy conditions. Another big issue right now is infectious diseases. Fortunately, good news about RSV and flu, which are both decreasing in intensity and the number of people sick. Many of you are still sick and recovering and still have a cough. Remember, we talked last time about this being a 3-week cough at least, going along with these viruses and the flu. The topic of the week is really measles. And there's been a significant outbreak in South Carolina, but there's spot measles cases all over the country. We have essentially lost our protection as a society from measles. And this is going to officially be released. At one point, we considered measles eradicated because of the high vaccination rates in the United States. We are no longer in that status. So we have pops of measles occurring everywhere. They are typically among people that have not been vaccinated, and that's much more frequent in the children. Measles is frankly one of the most infectious agents that exists on the planet. So it gets to 100% levels of infectivity if someone has been with another person. It is spread by respiratory bugs, and you don't even have to cough to be spreading the measles virus. Anyone within 6 feet is considered at risk, but measles also can lay in the air as a small little virus, and somebody who's coming in behind someone else can pick up that virus. So it is very clear that if you're exposed to someone with measles, you are considered at risk and have to go into quarantine. And that quarantine can last for some time because the measles bug itself has a rather delayed presentation. So we look for measles when we have rash and a cough. Those are the first two symptoms. And the rash is a red rash. And these are typically cases in children. They have a tendency to break out in their face and around their eyes. And they soon after have a cough. So it's a combination of high fever, cough, irritation around the eyes, and then irritation that's on the roof of their mouth, which has a particular name. It is very important for those around anyone who is thought to have measles for them to wear an N95. Remember, that's your most protective mask. And if possible, if this child can tolerate it, put a mask on them so that even if they cough, a lot of the viruses are caught in their mask before they get out into the free air. In addition, because this bug can sit places, if you're dealing with a measles patient, you should be wearing eye protection and a gown and gloves that we usually do. We do not want to go into a healthcare building with someone potentially with the measles. So you would, call somebody and let them know, hey, I think I have a measles patient, or I think my child has measles. They oftentimes will then send somebody outside or come somewhere to test that patient before they're brought into a healthcare building where they can expose lots of other people. Measles is a deadly disease. Very clearly, even in people who have good immune systems, they can die of this. It causes a systemic reaction, in particular in the lungs and in the brain, which can be fatal and which can be impossible to treat. So that's why we have wanted to eradicate measles and thought that we had, but unfortunately, it is back. And there are now hundreds of cases in the state of South Carolina, and we have spot cases across the country. For our EMS people, we're educating them about what these, in general, children look like, and we want to prevent spread to our people and to our people's children and to other patients and in the back of the medic unit. So we have to do special cleaning of that. So be aware of this old disease that's turned new. Get everyone immunized who should be immunized. The more the herd is immunized, the more that any people that are around the herd will be protected. So that even if there's a small number of people who won't or can't get vaccinated, if we have more people get vaccinated with this very safe, very old vaccine, we protect those that can't get vaccinated. So we're doing cold weather. We're doing a wind down of the flu and respiratory bug season. And then these spot conditions that occur. Measles is something we haven't had to talk about for many, many, many years. It used to be a killer in my generation. We had eradicated it, and it's back. DocTalk, just so you know, Heart Month starts in 2 days. And February, clearly Heart Month. For our public safety providers, don't feel bad and lay down and die. And that's been a recurrent message, particularly in the fire service, that somebody says, I just don't feel good. I don't know what it is. Or maybe they do and don't want to tell anybody about it. And unfortunately, we have firefighters who die in their bunks in the stations, or they go home and die at home. And that's a condition we clearly want to prevent. Many cardiovascular diseases that we'll talk about this month are preventable, and it comes from you knowing your risk factors, knowing what early symptoms may be related to chest pain, fluttering, discomfort when you're exercising, etc. We'll talk about that. That's February. Next time we talk will be right around Valentine's Day. So let's hope weather gets better and conditions get better around the country, and we celebrate a real nice Valentine's Day. Doc Talk, here we are into January. Take care of yourself.